with Chung Yi. My name is Ray Ma, and I'm the host and a writer for TechBuzz China, a podcast on China tech. Today, I have with me Ms. Chung Yi, who is the Senior Vice President and Chief Marketing Officer of WeDoctor. Ms. Chung has dedicated her career to the research and advancement in global tech. She has also spent over 10 years as a senior journalist at China Central Television and even 4 years in Africa covering the continent. So this interview should be very easy for her, for you, right? Um, Ms. Chung is also a council member of the China International Exchange and Promotive Association for Medical and Healthcare, otherwise known as CPAM, and she holds master's degrees in law from Beijing Foreign Studies University. So, very pleased to have you with us here today to discuss WeDoctor. For people in the audience who don't know the company very well, that's the first thing we should do. Yi, could you tell us more about the company and specifically the scope of WeDoctor's business?
Okay, good morning and good evening, Rui and everybody. This is Cheng from Beijing. It's a pleasure to be in this conversation. WeDoctor is a leading digital health platform in China. We were founded in 2010 by Jerry Liao and his team. We started by offering patients 挂号 service, which means making appointments on the internet with certain doctors so that people don't have to stand in lines for hours in the hospital. This has improved the experience of patients by saving them hundreds of millions of hours. And what's more important, we started to connect patients with the hospitals and doctors on the internet. And now WeDoctor has grown out of that. We offer full stack solutions, both online and offline, that touch care delivery, pharmaceutical supply chain and services, screening and diagnostics, health insurance, and health data management. And actually, WeDoctor is leading and representing the evolution of digital health industry in China. As I said, the first stage, we brought physical hospitals with internet capabilities so that people can book online. And in 2015, we got the first license of China's internet hospitals. Actually, before all the hospital licenses were issued to physical hospitals only. And WeDoctor's internet hospital that not only link the patients with the doctors on booking, but can also provide medical consultation for light disease as well as e-prescriptions. So that's stage number two. Starting from last year, we started to build health maintenance platform, which is a comprehensive digital solution for China's healthcare industry. To be simple, we work with the government, public hospitals, doctors, pharmacies, pharmaceutical companies, insurance companies to optimize the resources. So it's far more than stage number one and number two. I will elaborate later on. So we have three major goals to achieve. That is to save the medical expenses, to make it more efficient for everybody on the supply chain, and to give the population better experience and better health. Rui?
Thank you for that. I hope that makes clear what WeDoctor's business is. I was able to research the company earlier this year when the coronavirus epidemic came about, and I did some special episodes for our audience on telemedicine, telehealth, especially in light of the pandemic. So I think what's really interesting to me is that as you said, the company started off from Guahao, and besides like the onerous sort of registration system that China had, there are other like shortfalls, such as an unbalanced supply of healthcare resources, especially in doctors who are specialists, and also I think in some of the equipment as well. So the medical triaging infrastructure that we take kind of for granted here in the West is not so great in China, and also there's a over reliance on public hospitals, especially Grade A or Sanjia hospitals. These are some of the things that if you in the audience weren't aware of, these are some of the notable deficiencies in the system. But how do you think how China's healthcare system has evolved post the pandemic, right? Now that COVID is effectively gone from China, how has the system evolved to meet these challenges? And specifically for WeDoctor, how have you been able to extend your reach this year using technology to address these challenges?
Okay, Reed, that's a great question. Um, actually, I think you're quite right about the shortfalls of China's healthcare industry. I think medical reform is never easy in any country or places. And in China, we saw many innovations in our healthcare industry actually followed by some policy evolution. So I would like to spend a few minutes sharing with you our stories fighting COVID-19 and the changes we saw afterwards, and you will get my point of view very easily. It was right before the Chinese New Year when COVID-19 broke out in Wuhan, and the whole country got into panic. And the Chinese New Year means the greatest migration in the world. 75% of the population move around, about 2 billion person time. So migration significantly increases the possibilities of cross-infection. Wuhan was the epicenter of the storm. However, migration put the whole country in danger. So the panic is like nobody is sure about themselves or nor about their families or friends. So the need to talk to a doctor rocketed. But the hospitals are packed with people, the infected, the suspected, and the people who were just scared and anxious. This made things even worse. So on January the 22nd, Wuhan was closed down. And the next day in the morning, we launched WeDoctor online consultation and education platform against COVID-19. On the platform, we aim to help the residents in Wuhan and then other parts of the country by calling on people who are not sure whether they were infected or not to talk to a doctor on the internet first, instead of visiting hospitals out of fear. And such consultations were all free of charge. Later on, we provided a wide range of services domestically, including virtual consultation for urgent care, remote consultation of severe cases, chronic disease prescriptions, and medication refills via China's basic medical insurance plan, as well as mental health and health education. The platform saw 10 million visitors on one single day at its peak time. Fortunately, we had recruited tens of thousands of doctor volunteers over that period of time. In some cities, the municipal government and the municipal health commission called on doctors to join the service online and appeal to the public that make inquiries on the internet before going to a hospital. So our platform had a total number of 150 million visits during the pandemic outbreak, and 65,000 doctors from various departments provided services to 2 million users in total. It's hard to imagine if all these people flooded into the hospitals and got cross infected. It would have been much more difficult to control the virus, of course. Um, However, the biggest challenge was how to help people in Wuhan. I think you must be interested in that. So, I mean, how to help people in Wuhan, not those who were infected with COVID-19. That's the job of hospitals, but those with severe chronic diseases like hypertension, coronary artery disease, diabetes, and so on. It was a big group of people, over 400,000. Their life was in danger without certain medicine. However, outpatient service were suspended in most hospitals for about 1 month, and pharmacies could help only a few of them. So the National Health Security Administration made a quick decision to introduce WeDoctor's Internet Hospital to Wuhan to provide online consultation, prescription, medication, and delivery to door service. What's more, to include our services into China's basic medical insurance program so that patients don't have to worry about the costs. Once our internet hospital was online in Wuhan, people knew that their life could be saved. Over 180,000 patients visited our internet hospital within a few days, and over 10,000 prescriptions were handled per day. I remember a lady, her father had chronic obstructive pulmonary disease, and her mother in law had breast cancer. For over 30 days, they could not go anywhere because of the pandemic. And finally, they received medicine at home from We Doctor Internet Hospital. Actually, it was the first time they tried Internet Hospital, and they were so grateful. So the practice in Wuhan further assured us that the demand of the patients, the need of the patients must be satisfied with fully integrated solutions, and it should be safe and efficient. And if you can solve only part of the problem, you're of very little user value or commercial value. So, as far as I see, the most important contributions we made to the prevention and the control of COVID 19 is that a new cooperative system was established with the hospitals focused on treatment of the confirmed patients and the online platforms concentrated on screening and helping people with minor problems or common problems or chronic diseases. We could easily tell that telemedicine was highly efficient and effective in terms of helping these patients, not only in the scenario of the pandemic, of course. Actually, it was the dream model, the objective of China's medical reform, that is, the hierarchical diagnosis and the treatment system.
Right.
Really.
The triage that you're talking about, that, yeah, in normal times people don't really follow and they just go to the hospital for everything, but because of the pandemic they were trained to not go to the hospital unless there was a true emergency. And I, even though I was in California the whole time the pandemic was unfolding, I could see that some of, these services, I think you guys even had services that were available to overseas Chinese, if I'm correct.
Okay,
So
shall I continue with some of the changes and opportunities we saw in the post COVID-19 period?
yeah, exactly. That's what I was going to ask. Have
Yeah.
those habits, continued?
Yes, that's interesting. COVID-19, dealt a heavy blow to the real economy. However, I think the digital economy saw massive opportunities, especially for telehealth or digital health. Actually, we doctors spent over 10 years trying to facilitate the medical reform of China with information technology, with the internet, with AI, big data, and cloud. But it looks that the outbreak of COVID-19 was an accelerant. The impact was revolutionary. Um, for one thing, we saw more supportive policies from the government. It's not easy. In China, the healthcare industry is highly regulated by the government, and the country's public care delivery system provide the majority of the healthcare services. And in China, we have a national the basic medical insurance program. You know that, and that covers most of the daily medical cost of its population. As a result, for digital health to gain further ground in China, government authorities' willingness to integrate digital health into our public healthcare systems makes a great difference. Um, I should say they used to take a quite conservative approach. Over the past few years, they gradually opened up to these new concepts like internet hospitals, but very prudent, very slow. But COVID-19, as I said, was an accelerant. Government authorities realized the value of digital health during the pandemic, especially its abilities to enhance the public health infrastructure. Let me take the Internet Hospital as an example. We initiated the Internet Hospital in China by the end of 2015. It's not easy at first, although it was legalized by the government later on. However, for the past 4 or 5 years, people had to pay out of their own pockets for the medical service online. But during the outbreak of COVID-19, in order to save those suffering from severe chronic diseases, the National Healthcare Security Administration agreed that the national medical insurance plan could pay for the medical costs online. That's great news. It means internet hospitals have finally become part of the public healthcare systems, just like those physical hospitals and pharmacies. Actually, regulators announced multiple policies this year to endorse digital health adoption. They published policy guidance driving the healthcare industry to focus on people's health rather than healthcare or treatment of diseases in the future. So this is highly aligned with the Healthy China 2030 guidelines. To be specific, the basic medical insurance plan can now reimburse certain telehealth services, and regulators are also exploring providers establishing new patients via telehealth for specific diagnosis. And if we look at a bigger picture, we can see the regulators are now promoting population health management through digital technology. So new payment models like DRG and the value-based per capita model are gaining momentum. So the significance of these regulatory milestones is comparable to the sweeping expansion of telehealth in the United States led by CMS. But I assume that the impact in China could be even broader given the reach of China's basic medical insurance program. So now we receive such support in more and more cities. That's a dramatic move. And another important change generated by the pandemic is that both doctors and patients started to trust online hospitals. When most outpatient departments were closed down, doctors knew that they were needed. They volunteered to work on the internet day and night to answer questions, to give directions, to relieve the anxieties of the patients. Not many of them were used to working on the internet before. And it's the same with the patients. Not many of them trusted doctors without being face to face with them in a physical hospital. However, during the COVID 19, they were left with no options. They tried the internet hospital, they were received by a doctor, maybe from other parts of China. They could choose to type, to voice chat, or to video call. And in some cities, internet hospitals give prescriptions and medicines were delivered to door. So people started to see that, oh, it works and it's trustworthy to use medical service online. Even elder people who are not so familiar with smartphones figured out how to find a doctor online to get my problem solved. So it's very inspiring. Let me give you some figures. Around June this year, we saw 3.6 times more consultation than the same time last year on the internet, on the WeDoctor internet platform. And we had 50,000 more doctors working with us. And monthly active doctors are 2.3 times of last year. Rui?
Yeah. Wow, those are pretty impressive figures that you're citing. So now that the regulatory environment is much more friendly, are there specific products or initiatives that you guys are working on launching?
You're right. Actually, when the virus go away and the hospitals gradually came back on track, lots of people asked the same question. Are the good opportunities for telehealth temporary? And in what scenarios can you do really better and more cost effective and more efficient? Actually, for many years, China has been committed to building hierarchical medical system, a primary care community health based healthcare system where they provide basic medical care and triaging function, as well as being the gatekeepers for more advanced medical needs. So, one important scenario is primary care. As I said, China published 2030 Healthy China guidelines, and we made a decision to focus on people's health rather than treatment of diseases in the future. Therefore, we must rely on the gatekeepers in addition to doctors. So, this gatekeeper should be familiar with your physical conditions and your major problems. However, one primary care physician needs to manage over 2,000 patients. How could they manage this without help? Now, I think digital health provides something really useful. On an internet hospital, the primary care physician can interact with people anytime, anywhere on their own initiative. And for people with common problems or chronic diseases, they can stay at home talking to their primary care physician, getting their minor issues dealt with, and the medicine delivered to door. And what's more, these primary care physicians can have consecutive data feedback. And by tracing people's behaviors, they have a better understanding of their health conditions and may provide their services more reasonably. And they are not on their own, they are connected with doctors from 3A hospitals, that is equivalent to academic medical centers in the United States. And these doctors from 3A hospitals could help with more complex situations. Another good one is management of chronic diseases. In China, about 30% of the population suffer from chronic diseases, including hypertension, heart problems, diabetes, etc. They spend 70% of the national medical insurance plan. And to better manage these chronic diseases, that is to say, to discover these problems as early as possible, to monitor relevant indicators consecutively, and to give proper medication to monitor relevant, to set up an entire plan, including nutrition and exercises, and to get people into good habits, will keep these chronic diseases under control and prevent complications. We didn't do this well in the past, but now I think telehealth can play a very important role in this regard. I'll give you a good example later. And in the long run, with more data collected, I think we should have a more and more precise patient profile, which will help to further improve our health management plans. Rui.
Yeah. Great. Preventative healthcare, I think, is the dream for countries globally, but let's hope that China gets there quickly. So actually, we're almost out of time, and then generally, as you know, we finish the segment with a lightning round where I just ask you what you think, overrated or underrated on a topic, related to your industry, and then you just tell me very quickly, like in one or two sentences, your answer and why. So I think because we were talking about preventative healthcare and telehealth, the one thing I want to ask you is, what do you think of the Teladoc Livongo merger? Overrated or underrated?
I shall say underrated.
Oh, why is that?
Telehealth could play a very important role in chronic disease management. So the merger of Teladoc and Livongo, I think, represents a perfect, fully integrated solution. Yeah, I think that's where the future of digital health lies.
So you think it's great, basically? Yeah.
Yeah.
Actually, a lot of people I spoke to thought it was underrated as well. What about AI in healthcare generally, more generally?
Well, I will say underrated, absolutely. Actually,
Okay.
the biggest wins for AI will be in the health sector, especially in China. In China, I don't have time to brief you the fundamentals of China, but you know that we have huge population, and not
Right.
everyone have access to good medical resources, experienced doctors. So AI will absolutely help in that regard. I think the
Well, you said
opportunity are
early. Yeah.
massive. Yeah, actually, we doctor made lots of efforts in developing AI application in diagnostics.
Yeah. The great population and just the low penetration of doctors. Like you said, each doctor is responsible for 2,000 patients. So it's AI hopefully will be very much helpful. Okay. I mean, we're pretty much out of
We're
time.
running out of time.
Yeah. Is there anything else you want to say before we say goodbye to the audience?
Actually, I would like to share with you some of our practice in Shandong and Tianjin municipality. I think that's very inspiring, but I don't know how much time left.
1 minute.
Okay. Okay, maybe next time.
Okay, all right. We will be sure to have Chung back next time to talk more about WeDoctor, one of the leading telehealth platforms in China. Thank you very much.
Thank you so much, Rui. Thank you for your time.